Are you required to have health insurance? As we navigate through life, we are often confronted with unexpected medical emergencies. Whether it's a broken bone, a sudden illness, or a chronic condition, healthcare costs in the United States can quickly add up. That's why having health insurance is so important. But are you required to have it? Under the Affordable Care Act, ACA, also known as Obamacare, most Americans are required to have health insurance. The individual mandate requires that individuals who can afford health insurance must obtain it, or face a penalty. This penalty is commonly referred to as the shared responsibility payment. The purpose of the individual mandate is to ensure that everyone has access to affordable health care. By requiring individuals to have health insurance, the idea is that healthy people will balance out the cost of care for those who are sick. This is known as a risk pool, or community rating. By spreading the risk across a larger group, the cost of healthcare can be reduced for everyone. In the next section, we will take a closer look at the individual mandate and its requirements. Understanding the Affordable Care Act, ACA. The Affordable Care Act, ACA, was signed into law in 2010 with the goal of increasing access to affordable healthcare for all Americans. The law introduced several key provisions, including the individual mandate, which requires individuals to have health insurance or pay a penalty. The individual mandate and its requirements. Under the individual mandate, most individuals are required to have health insurance that meets certain minimum requirements. This includes coverage for essential health benefits, such as hospitalization, prescription drugs, and preventive care. There are some exemptions to the individual mandate. For example, individuals who cannot afford health insurance, those who have a religious objection, and certain undocumented immigrants are exempt from the requirement to have health insurance. To avoid the penalty, individuals must have what is considered minimum essential coverage for at least 9 months of the year. This can include coverage through an employer, a government program like Medicare or Medicaid, or a private insurance plan. Penalties for not having health insurance. The penalty for not having health insurance is calculated in one of two ways. Individuals can either pay a flat fee or a percentage of their income, whichever is greater. The penalty is calculated on a monthly basis and is prorated based on the number of months without coverage. It's important to note that the penalty for not having health insurance has been reduced to $0 under the Tax Cuts and Jobs Act of 2017. However, this does not mean that the individual mandate has been repealed. The individual mandate is still in effect, but there is no longer a penalty for not having health insurance. In the next section, we will explore the exemptions to the individual mandate in more detail. Exemptions from the individual mandate. Overview of exemptions from the individual mandate. While most Americans are required to have health insurance under the individual mandate, there are certain exemptions that may apply. These exemptions allow individuals to avoid the shared responsibility payment if they meet certain criteria. There are a variety of exemptions available, including exemptions for financial hardship, religious beliefs, and certain life events. Exemptions are also available for individuals who are not legally present in the United States. Information on how to apply for exemptions. If you believe that you qualify for an exemption from the individual mandate, you must apply for it through the health insurance marketplace. You will need to provide documentation to support your exemption, such as proof of income or documentation of a qualifying life event. It's important to note that you must apply for an exemption before the end of the tax year in which you are seeking the exemption. For example, if you are seeking an exemption for the 2021 tax year, you must apply by December 31, 2021. Examples of common exemptions. Some of the most common exemptions from the individual mandate include financial hardship. If the cost of health insurance would be more than 8% of your household income, you may qualify for an exemption based on financial hardship. Short coverage gap. If you were uninsured for less than 3 consecutive months during the year, you may qualify for an exemption. Religious beliefs. If you are a member of a recognized religious sect that opposes health insurance, you may qualify for an exemption based on religious beliefs.